15 parts. Then according to Sharandar, Acharya Sharandar, Dravya 1 part, milk 8 parts, and water 32 parts. Then what is the actual procedure of Kshirpak Kalpana? We have to take post powder, that is Yavakut churna of expected drug, that is medicinal drug, which we have to, whose the Kshirpak we have to prepare. Then add 15 parts or 18 parts according to method. या फिर ये शारंदर या शारंदर और आचार्य यादव जी add 15 to 32 parts of water, then heating on slow fire until total water content is evaporated. Then Kshirpak is ready. Then there is one different point according to Acharya Vapan, that is, first we have to prepare vata of given drug by adding 16 parts water, reducing it to 1/4. After filtration, add cow milk as same as proportion of vata, and then heat in on low gas flame until the total water content is evaporated. Here, important is we have to prepare quart of that given drug. Then what are the precautions? That is, we cannot prepare Kshirpak of the dravyas which are amla, kashaya, and lavana rasa pradhan, because these rasa can usually spoil milk. So here is one precaution is taken, that is we cannot prepare Kshirpak of dravyas which are amla, kashaya, and lavana rasa pradhan. Then what is clinical utility? First of all, Rasam Kshirpak. We can use in it as it is Deepan Pachan in chronic fever, as it is Vibandhanashan, we can use in heart disease, Shulanashan, abdominal pain, constipation, उष्ण तीक्ष्ण होने की वजह से, intestinal growth, skin diseases, worms, indigestion. Arjun Kshirpak, obesity, heart diseases, urinary tract problems and ulcers, and it is cardioprotective. Then Shatavari Kshirpak we can use in infertility or as lactogenic in lactating mothers. And Shunti Kshirpak in vomiting, dyspnea, spasmodic pain, heart diseases, edema and piles. Then Haridra Kshirpak, cough, anemia, wounds, ulcer, intestinal growth, skin diseases, worms and edema. Dokshir Kshirpak, diuretic, urinary tract disorders and fever. And next, Erandamul Kshirpak in chronic fever, constipation, joint pain. Ashwagandha Kshirpak, infertility, chronic bronchitis, tonic. Then what are the important points to remember according to point of view of examination? First of all, it is the Upakalpana of Vata Kalpana. That is, it is Upakalpana of Vata Kalpana, which means it is subtype of Vata Kalpana. Then second point we have to remember is drug as to milk as to water proportion by different doctors. That is, according to Acharya Sharanandar, it is 1 to 8 to 32, and according to Yadavji Trigamji, it is 1 to 15 to 15. Then definition as you